because of fleas carrying plague. Those fleas are camping out on prairie dogs there, and the Tri-County Health Department says it's still safe for the Labor Day weekend concerts at Dick's Sporting Goods Park, just no camping. They don't want you staying there overnight.
Well, we're lucky because Dr. Michelle Barron, who's the director of the infection prevention at UC Health, joining us now to talk about the concerts themselves. Before I ask you a technical question, is this tough for you because your family, you have fish fans in your family, right?
Big fish fans in my family,
And
yes.
So they don't want like you giving bad news to fish concerts, right?
No, they don't.
So they're not going to allow camping, but the concerts will go on. Does that really make things safer? Is that a big difference, do you think?
Oh, no, it makes total sense. So the way you get plague or get infected in plague is you get bitten by fleas. And if you're camping, you're going to be sitting in the grass, or you're sort of in the area where the fleas potentially are going to be at. You wouldn't expect the fleas to be in the stadium proper, so it's perfectly safe to go to the stadium and listen to the concert.
We were talking earlier about the actual effect on humans. How likely is it that someone becomes infected with plague, and then what happens if that person becomes infected?
So you would have to be bitten by a flea that has plague, and so depending on the concentration of fleas with plague, that would be sort of the starting point. If you got bit, then it usually causes you to have flu-like symptoms. So a few days later, you'd start to have fever, chills, maybe fatigue. And then the classic case is what we call bubonic plague. You would have swelling of the site where you got bit by the flea, and the lymph nodes closest to that area would start to swell and cause you significant pain.
This may be a new high for plague awareness because of the fish concerts, because of all this going on. Is that good in some ways? Is that making people aware of what plague is and that it is still part of our world right now, that it maybe makes us a little smarter?
I think so. I think it's always these rarer diseases that you sort of think about are only historical, the fact that they still exist, because there's easy ways to prevent them, obviously. How do you prevent ticks and fleas? You wear insecticide if you're going to be out and about camping.
So what's the approach here? I mean, can we get rid of them? Is there an easy solution to this?
I wish we could say we could eradicate it completely.
Yeah, right.
We tried for a very long time.
We have,
it hasn't
but
happened yet.
We haven't. I mean, you'd have to eradicate all fleas and
Right.
the hosts of the fleas, and which would be obviously traumatic to the environment. If you start getting rid of certain species, you know, there's always some consequence that we'd see.
But health departments, are they going out, and what does that eradication process look like?
So a lot of it is spraying for fleas,
Yeah.
and so it's certainly the health department is very engaged in these kind of things. Often they'll see prairie dog die-offs. That's kind of their indication that there's probably a plague epidemic going on in that area. And then they can test the fleas, and then if they find it, they do measures to promote death of the fleas.
How does this cycle up and down? Obviously, there have been many years where we don't even talk about plague. We're not really aware of it as being an issue.
Sure.
And now here we are where it's in the metro area.
Yeah, well, believe it or not, we've had cases in Colorado in the last couple of years. They just don't always get to the point where maybe it becomes newsworthy, but the die-offs certainly occur more frequent than you probably realize, and unless you live in those areas, and prairie dogs are everywhere.
So are we building into more prairie dog colonies, creating more human interaction with plague? Is it climate change? Are there anything that you can point your finger to that sees that go up and down?
Certainly there's seasonal cycles, and so when you have wetter springs where a lot of the rodent population is allowed to populate, then you're more likely to have then hosts that then can carry the fleas that then can get into human contact. So it's kind of one of those things where we certainly had a pretty wet spring and early summer.
Sure, yeah. Most importantly, would you feel comfortable going to this concert?
I would.
There you go.
No question about it.
That's probably the most important question.
Approved treatments or vaccines for the coronavirus pandemic currently. But drug makers are scrambling to fix that. I don't think we've seen anything like this as far as several dozen drug makers rushing to the call to develop different therapeutics against this virus. So there are three main efforts I'm watching for these near-term repurposed drugs. One is called remdesivir. Remdesivir was previously tested as an Ebola treatment. It's being tested in patients who have already been infected and have moderate or severe cases of COVID-19. It is a broad-spectrum antiviral, meaning it's not targeted at one specific function, but sort of has an activity that could be applicable against a range of viruses. There's an HIV drug called Kaletra that's being tested in some clinical trials, and AbbVie, the drug maker behind that, has donated that in quantity to China for that testing. Chloroquine is an old generic anti-malaria drug. This drug was first approved in 1949 by the US. So there's a long safety profile where we understand the toxicity and how to take the drug. It's very unclear at this point if it'll work in coronavirus. There's been a lot of anecdotal reports of success. And some countries, including China, South Korea, and even Belgium, have put chloroquine directly in their treatment guidelines for coronavirus. So in the medium term, we're watching companies like Eli Lilly, Regeneron, and for biotechnology. They're all developing monoclonal antibodies, which are essentially drugs that would fight the virus, and there's a potential that they could be used prophylactically, which means when you look at a high-risk patient population, healthcare workers, family members of COVID-19 patients, those could be the targeted groups for a prophylactic antibody, which would essentially protect that person from being infected. This is very early research. None of these are in clinical testing yet. They're still being developed in laboratories. But the speed of this pandemic has forced drug makers to act as quickly as possible. In the long term, vaccines are the gold standard of drug development with infectious diseases. Vaccines can prevent infections before they even occur, unlike the short-term or medium-term treatments, which would generally treat patients who already have severe or moderate cases of COVID-19. That also requires much longer testing to make sure a vaccine is safe and effective. You don't want to give a treatment to hundreds of millions of people that might make them worse or not work against the virus. So this requires extensive clinical testing. But the drug industry is also moving extremely rapidly at developing these vaccines. The first clinical trial of a vaccine has already started. The first patients have already received doses of an experimental vaccine against the coronavirus. So while that trial has just begun, it's a long road. It's kind of the first mile in a marathon for vaccine development. Top US health officials have estimated that timeline at 12 to 18 months to determine if a vaccine is safe and effective against this virus. The questions that remain are about price and access. Who would get it first, and what would the price be?
At Chewy, you can shop America's #1 pet pharmacy anytime, anywhere.